my name is Kimberly Collins A. Paleg, and today we are going to perform assessing the neurologic, musculoskeletal, and peripheral vascular system. So first is to identify the patient and explain the purpose of the examination and answer any questions. Hello, ma'am. Good morning. Ma'am, my name is Kimberly Collins A. Paleg. So, I will be your student nurse for today. Ma'am? Okay. Before I'll start, ma'am, can you state your name? Okay, ma'am. When is your birthday?
December 2001.
So, ma'am, what do you want me to call you?
Yeah.
Kiana na lang po. Kiana. Okay, ma'am, Kiana. Do you have any history like past medical issues like mga past surgeries, mga ganon? Wala naman po. Okay po. Do you have any pain or discomfort na nararamdaman ngayon? Wala rin po. Okay. So, ma'am, ngayon po we're going to assess your neurologic, your musculoskeletal, and your peripheral vascular. So, ngayon, ma'am, kailangan ko po ng urine specimen if possible kasi baka magkakaroon po tayo ng urine test after ng assessment. Okay lang po ba yun, ma'am? I-start na po tayo. Okay po. Sige po. And then, after that, we perform hand hygiene. And then now we're going to help the patient or assist the patient in the sitting position. Okay. Now, let's assume that the patient is undressed and change into the hospital gown or the patient's gown. So next is we're going to start by assessing the patient's mental status. So ma'am, I just want to ask some questions and answer me honestly. Okay lang po ba? Okay ma'am, start na po tayo. So ma'am, can you tell me what is the month today?
August 13.
Okay ma'am, can you tell me who is our president?
President Rodrigo Duterte.
Okay. May I know who is your favorite artist?
Penguin Loss.
Isang network, ma'am.
GMA.
Okay. So, ma'am Kiana, anong oras po kayo dumating kanina?
Ay, 11:25.
Oh, okay, ma'am. Kumain ka po ba kanina, ma'am? So, ngayon, can you tell me yung mga best moments mo? Like, kung ano yung mga naalala mo?
Then sa New Year.
New Year. Ano po yung mga ginawa niyo sa New Year, ma'am?
Valentine, kakapakota.
Okay, ma'am. Good. So, ma'am, I want to tell you some proverb and then explain niyo po sa akin kung ano yung pagkakaintindi niyo, okay? Okay lang po ba, ma'am? Okay po. Sige. So, ma'am, when you want to make a omelette, you need to break a few eggs. So, ano po yung pagkakaintindi niyo sa proverb na yun?
Pag nagre-reach ka ng goal, kailangan mo din mag-sacrifice also.
Okay, very good. And now for this speech. So, ma'am, now I want you to follow me or repeat after me. Okay, ma'am? So, You're beautiful.
You're beautiful.
Okay. I'm pretty.
I'm pretty.
Okay, very good. So, for the assessment of the mental status, level of consciousness is normal since she can answer all the questions as well as the orientation to person, place, or time. And for the past memories, she can recall the things that I asked her. And for the proverb, she can simply and normally can explain and correctly explain the meaning of the proverb. Now we're going to check for the cranial nerves. So ma'am, so i-check ko po if there is any problem or abnormalities sa my cranial nerve nyo. So ma'am, shall we start? Okay po. So now, for the cranial nerve functions. So ma'am, I want you to close your eyes and include one of your nostrils. Okay ma'am? So you identify niyo po kung ano pong ibibigay or papaamay ko sa inyo. Ready po ma'am? Okay po.
Alcohol.
Okay. The other side. Okay ma'am, close your eyes. What?
Lotion.
Okay. So now for the visual acuity. So ma'am, please stand po. And then, the patient will stand 20 feet away from the Snellen chart. 20 feet away. And then, close your left eye. Okay, ma'am? So, ano pong number yung nababasa nyo?
8.
Number 8. So, ma'am, ano pong mga letters? Please read.
D, E, F, P, O, T, E, C.
Okay, ma'am? So, sa right eye naman po ang tatakpan natin. Okay, ma'am, ano pong number?
7.
7. Okay po.
F, E, L, O, P, Z, D.
Okay. Then after the visual acuity, now we're going to check for the pupillary constriction. So ma'am, I want you to focus on my eye. Okay ma'am, ready po? Okay. Okay. Now, I want you to focus po kung saan po yung direction. But, yung head nyo is steady lang po. Okay? Huwag nyo gagalawin. Okay po? Okay. Now, I want you to smile, ma'am. Like ganyan. Okay, steady lang po. Smile. Okay, front. Okay. Now, I want you to wrinkle your forehead like this. Okay. Now, I want you to puff your cheeks. Okay. So now, for the test hearing. Now, ma'am, I will going to whisper something and you will going to repeat after me. Okay, ready?
You're beautiful.
Okay.
God is good.
Okay, very good. Now for the gog reflex. For now, we're going to put a gloves to avoid contamination or any infections. Just a moment, ma'am. So, I don't have a tongue depressor, so I'm gonna use some wooden cotton applicator. Okay, ma'am, please open your mouth.
Okay.
And then after using this, we're going to put it in the receptacle. So now, ma'am, I will going to put my hands on your shoulder as you, as the patient shrugs. So we're going to put a pressure on it for the resistance. Ma'am, shrug it, shrug your shoulders. Okay, you're pretty strong. And now for the left and right. Okay, okay. Now, ma'am, I want you to move your head side to side. Okay, ear to ear, like ear to shoulder. Okay, again, ma'am. Okay, and then chin to chest. Okay, and then down. Okay, very good. So for the test hearing, she can identify or interpret the information I give to her or what I whisper. So for the gag reflex, I didn't see any masses or swelling inside. So there is no abnormalities. I don't see any abnormalities. And for the head and neck, it is normal since there is no wasting of muscles. It is symmetrical. For the neck, for the muscles in this area, it is no normal. I don't see any muscles or swelling. Now, ma'am, I want you to lay down. Now, okay, now we're going to palpate. Now for the temperature. Okay. Okay. For the in the upper extremities, um, the skin temperature is normal since it is my patient is warm and my patient has no edema or any abnormalities in the upper extremities. Now, ma'am, I want you to flex your uh, put your hand like this and then rapidly up and down. Move your hand up and down. That's it. Okay, then flex your arm up. So I'm gonna put pressure in it and then I'm gonna push it. Okay, then like this. Okay, very good. Now we're gonna palpate your hands, wrists, and fingers. Okay, there is no muscles. There is no swelling in muscles. And for the capillary, check it. Okay. Okay, all is normal since it can is going back to the normal state. To palpate for the radial and brachial pulses. Ma'am. Okay. So for the pulse, it is 2 plus, so it indicates normal findings. Now, ma'am, I want you to squeeze my hands. Squeeze my hands. Squeeze my left hand. Sige pa, pulo pa. Okay, very good. Now, ma'am, I want you to close your eyes. Then, sabihin niyo sa akin, or please tell me kung ano yung lalagay kong number. So, you need to identify the number I will gonna write in your palm. Okay, ma'am?
Four. Two.
Okay. Okay, close now.
Three.
1. Okay. Now, close, ma'am. Tell me what is the object is. Okay, ma'am?
Good.
Okay, very good. Now, ma'am, I open up yung... Okay, so the patient can identify the item that I give to her. Now, ma'am, I want you to lie down to position the patient in the supine position. So now, ma'am, I will going to check your lower extremities for if there is any abnormalities or any lesions in the lower extremities. So for the moment, ma'am, I'll just get my gloves. Okay. Now for the temperature. Okay. So, okay. So for the lower extremities, the temperature is normal and there is no swelling or any masses in this area. So there is no lesions available or any varicose veins or any type of skin disorders. So I didn't see any or observe any edema at all. So all is normal. Now we're going to palpate for the lower extremities, the pulses in the popliteal area, dorsalis pedis, and posterior tibial. Okay, it is 2 plus, so it indicates normal findings. Now, ma'am, I want you to raise your one leg straight. Okay, and the other one. Now for the lateral. Okay, okay. Okay. Now, okay. Now, pupush ko to. I-push mo. Okay. Okay. Naman. Okay. Ito naman. Okay. Ito naman. Okay. Very good. I observed that the patient is so strong, so it indicates normal findings. Kasi kapag like nahihirapan siya sa mga procedures na like na ginawa ko kanina, it indicates is causes by the stroke and other abnormalities sa lower extremities. Now, okay, ma'am, now we're going to check for your tendon reflex. Okay, sige ma'am. Second position. Okay. So, first is sa my wrist. Two centimeter. Tricep. And now for the patella and the Achilles. For the tendons, reflexes. Okay. For the tendons, reflexes, all is normal. So there is a response, so it indicates normal findings. If it's no response, it indicates abnormal findings. Okay. Now, ma'am, lay down. Okay. Like, ipupush ko the pistil na ginagawa. Okay? Now, repeat it. Okay, very good. Now, sabi mo sa akin kung nararamdaman mo, okay? Okay, very good. Okay, all is normal since the patient can feel anything, and she is so strong, so there is no abnormalities like causes strokes. Okay, and now we're going to proceed for the next procedure. So, ma'am, now stand na po tayo. Stand up. Okay. Okay, now, ma'am. Now, and then close your eyes. Close your eyes. Arms on the side. Okay. Okay. Okay na. So, as I observed, my patients can walk normally and even on toe or on heels, and she can normally stand even her eyes is closed. There is no any shaking movement as she stands, so all is normal. I did not observe any abnormalities as she walks and as she stands.